Good evening, Dr. Cadet and Aspen BSN completion students. My name is Patricia Jones, and I'm going to be presenting this evening on global health, policy, and the future. The objectives in this presentation: this assignment will define the Sustainable Development Goals, a focused presentation about one particular goal, vulnerability for a broad range of people, analysis of current health policies, and goal implementation and funding. The Sustainable Development Goals were created in 2015 to achieve and maintain a healthy future for everyone. They specify national challenges and ways to improve them, with a target date of 2030. Good health and well-being is Sustainable Developmental Goal number 3. In order to fully benefit from this initiative, people must be healthy. Eating a varied diet consisting of fruits, vegetables, complex carbohydrates, and adequate water intake are helpful. Always being mindful of portion sizes, adopting a lifestyle with moderate exercise, and limiting alcohol consumption. Additionally, refraining from substances that are mind-altering are known to promote health and well-being. Lastly, good sleep is to never be underrated. Sleep should be restorative, and once again, it promotes health. Many of the interlinked Sustainable Development Goals relate directly or indirectly to human growth, surviving, and thriving. As strides are made in one area, assuredly there will be progress in the systematic goal of achieving health and prosperity on a global level. Current practice informs that although there are 17 distinct Sustainable Development Goals, they all relate to the bigger picture of health. The use of existing policies and partnership is necessary to build a platform that stakeholders can enlist in. Collectively, they can contribute to addressing and achieving Sustainable Development Goal number 3. Nurses are in a position as trusted healthcare professionals to advocate for the most vulnerable populations. Nurses must address vulnerable patients with empathy, education, and advocacy. Nurses with advanced degrees can function as leaders in healthcare policy and global health with impact at the bedside and beyond. I chose Sustainable Development Goal number 3 because it represents inclusivity and a reason for all the other goals. Focusing on all the goals will help people, families, communities, populations, and nations achieve and maintain good health and well-being. Businesses, government, and private sector investors are needed to see this goal realized. Global health products and services that focus on technology advancements and proven benefits over financial risks are needed to see these goals achieved. As previously stated, the 17 Sustainable Development Goals are inextricably linked. People that are healthy are happy and productive. Addressing HIV, tuberculosis, malaria, and COVID-19 are making the world safer and the people are healthier. Securing health care for all remains a challenge, and there has been significant progress made thus far. Despite all the progress, there remains a lot of work to be done. The gap between the development in evaluation science and evaluation practice is significant. These measures discussed in today's presentation are collectively working in the right direction to achieve good health and well-being worldwide. I hope you learned a lot during this presentation, and thank you for allowing me to experience this with you all. Have a very good day. Thank you.